So good morning, can you hear me? Okay, great. So let's make this a conversation rather than go through a bunch of slides. You know, I was asked to talk about public health in India and whether that really differs from the world, so I thought it might actually be more interesting to ask you what you think. Are we different from the rest of the world? Really? Are we different from other people in South Asia? Are we different from people in Europe? What makes us different? Especially if we begin to think about public health, what are the differences between us and the rest of the world? Now, the burden of disease, I heard somebody say life cycle, lifestyle diseases, healthcare facilities. So you have a pretty good idea of what is going on. So what do you think is the number one killer of people in India today? Ischemic heart disease. Well, cardiovascular disease, yes. It depends on who you look at, whether you're looking at urban populations, whether you're looking at rural populations. We are 1.3 billion people. And when you think about public health, you can think about public health in a variety of different ways. What constitutes a healthy public? Do you know when you're feeling good? Yes? Okay, you know when you're feeling good. If you're not feeling good, what do you do? Go to a doctor? Do doctors tell you, what kind of advice do you get from a doctor? If you are overweight, they tell you to exercise. Do they tell you about nutrition? Do they tell you about how to promote health? What are all the things that you should be doing to maintain a healthy lifestyle? The doctor sees you, the doctor has 200 patients standing outside their room. They will see you, they will say, okay, what have you got? You've got fever, cough and cold. Here, take these 4 medicines and call me if you don't get better. Or come back if you don't get better, right? So nobody is telling you about what prevention is about. How do you promote health? What is it that you need to do? When you look in schools, do you study biology in schools that has a health component? Yes, of course you do. So I was very interested when I had children and my son went to school, and in class 3 he came back with his biology textbook, and the biology textbook taught him about what a hinge joint was, what a ball and socket joint was. And I was looking at that and thinking, how is this even relevant to anything that people are going to do in the future, in 3rd grade? By the time it came to 8th grade, he was studying vaccines, and he had to learn about bacterial vaccines, viral vaccines, which one is a killed vaccine, which one is a live attenuated vaccine. Again, it makes very little sense when you don't understand why vaccines are being used in a global context. So if we are to think about how to prevent, let's discuss vaccines for a moment, right? So have you seen things in the paper and in newspapers, magazines that talk about people who say that vaccines are associated with autism, that you shouldn't give your children too many vaccines? Yes? True or not? True. Based on what? There's a paper published in the Lancet. Right? There was a paper published in the Lancet that said that children that got measles vaccines had a higher incidence of autism following that vaccine. From a guy called Andrew Wakefield, published in the 1990s. It turns out that Andrew Wakefield, nobody was able to reproduce his results, that Andrew Wakefield had a company that was treating kids with autism, was offering to make a diagnosis for them, and the paper has now been retracted, but people still believe that vaccines are associated with autism. Another area that people tell you about is that vaccines can, giving too many vaccines at the right time is dangerous, right? You should separate the vaccines out. Does that make biological sense? Well, when you eat, how many antigens do you take in? When you breathe, how many antigens do you take in? You are encountering millions of antigens every day and you're able to handle them, and you're telling me that when you get 4 vaccines together, you can't? Okay? So I think learning to assess the evidence is something that we should be thinking about. There are always no drug is 100% safe, no vaccine is 100% safe, no food is 100% safe. Take too much of anything, it is bad for you. But when we think about the promotion of health, the prevention of disease, the ability of people to be able to critically evaluate what evidence is presented to them is very, very important. And we don't do enough of that. Now, if you think about, you mentioned ischemic heart disease, and we had lifestyle in that corner of the room. Now, is lifestyle a problem for children? At what age? And in what kinds of settings? So if you think about what is happening today, our society is changing. You pointed out lifestyles are very different. You spend a lot of time on your phones and your computers. You eat out a lot. You get a lot of fast food. You don't get as much exercise as you used to, especially when you are urban. And what is this setting you up for? It's setting you up for diseases that are going to be with you for a very, very long time. So what the past was like for India, infectious diseases were a major concern. So if you look at how health is provided in India, it's provided in 2 main areas as public health. One is preventing infections, which is the vaccination program, and then a number of vertical programs that are intended to control diseases. So if you look at tuberculosis, we have a tuberculosis control program, we have an AIDS control program, we have a malaria control program, we have a filaria control program, we have a soil transmitted helminth control program, all of which are verticals. So you're targeting a disease and you're not targeting the person who has it. We provide a certain level of maternal and child health care, but what is it that we do in public health for what is turning out to be our biggest killers, which is cardiovascular disease for the most part and an increasing incidence of cancers? Where do you go when you have those? For us, and we are largely all middle-class people here, we have an option. We can go to the local clinic, the local hospital. Who pays for this? Who pays? You pay. Medical insurance pays. Who has medical insurance? Especially for outpatient care, medical insurance is limited to a very thin sliver of the population. 70% of all healthcare expenditure in the country is currently out of pocket. A small proportion is with insurance, and the rest is provided by the public health system. A country that is making its people spend out of pocket for 70% is not providing public health services. Okay, so now when you are spending money for health care, where will you spend that money? What are the components in which money is spent? When you go to a doctor in a clinic, there is a consultation fee. You're paying for the doctor's expertise. What will the doctor do? Give you medicines. You will pay for the medicines. How often do doctors order tests? Always. So doctors order tests frequently if they think it's going to make a difference. Now, anybody in this room has gone to a doctor for a fever? Yes? Put up your hands. Did you receive a test? How many of you, keep your hands up if you actually received a test when you had a fever? Okay, so the number has shrunk quite a lot. Was that test a blood culture? How many? 2, 3, 4, 5, 6 people. Okay? Did you get antibiotics for it? All those who got blood cultures, did you get antibiotics for it? No, not everybody's hand stayed up. Okay, usually you do a blood culture if you are suspecting that the person has a bacterial infection. If you suspect that a person has a bacterial infection, you should, in that case, give antibiotics. Others of you will have gotten blood tests. Sometimes it would have come back positive for dengue or chikungunya or something like that. Did you get antibiotics for it? About 40% of all dengue and chikungunyas which don't need antibiotics get antibiotics. And this is the problem. We don't have a structure in which we deliver public health to the country. Whether it is how to prevent, how to diagnose, we have no rationalization for the cures. If you have a fever in South India, the antibiotics that you get will be different from the antibiotics that you will get in North India. The tests will be different. It is not because the causes of disease are different. In some situations they can be, but in the bulk of cases it tends to be what local experience has been, and it may or may not be rational. For example, with a disease that I study, typhoid fever. Typhoid is a fever that has been with us through history. It was around the entire world. It was a disease that vanished from the Western world because they got sewer systems and safe water supplies. It is a disease for which India continues to be highly endemic. And now, typhoid used to be a killer. In my family, my father's brother died of typhoid. My father-in-law's brother died of typhoid. They were born in an era where there were not antibiotics to look after typhoid. As soon as antibiotics became available, they started to be used very widely. This was in the 1950s. And by the late 1960s, you had the first indications that the bacterium Salmonella typhi was becoming resistant to typhoid. Now, with that, we switched the antibiotics. We got another class of antibiotics. We got another class of antibiotics. We wound up with multi-drug resistant Salmonella typhi. We are in a situation today where in Pakistan there is an outbreak of Salmonella typhi, which is called extensively drug resistant, which means that there is only one antibiotic left that can be given orally that can treat that particular Salmonella typhi. Now, diseases can cross borders very easily. So if that S. typhi comes to India and establishes itself, we are down to the last antibiotic. Why did this happen? Sorry? Lots of doctors prescribing lots of antibiotics, lots of patients not knowing how long to take antibiotics, stopping them when they feel better, so you have incomplete courses. lots of combinations of antibiotics being given, people going to pharmacies buying antibiotics because they think they know how to treat themselves, right? How many college students here who left for college with antibiotics? So every college student that I know carries a little pack of medicines with them, and there are always antibiotics in there. You don't know what to use them for, but you will use them. And this is leading to huge public health issues that we don't really know how to handle. Controlling antimicrobial resistance is going to wind up being a huge problem for us. So what is it that we can do together in India? Is it all the government's job to fix this? Do we have a responsibility? What's our responsibility? If health matters, if being healthy, staying healthy, provision of a rational approach to treating disease matters, what is it that we can do? Creating awareness. Go ahead.
When doctors are getting their degrees of MBBS and MD, then we can at least keep a course in them only to, which is for public health. It will like train the doctors only who will like create awareness and which are the major responsible.
Yeah, so actually there is a training program which is called Preventive and Social Medicine, or called Community Health, that undergraduate doctors do have to undertake, and they have a paper in that. The only problem is that, we are so urban that we don't understand what the rest of the world looks like. This is something that happened to me. I grew up in small towns. I went to a medical college, and at the end of 6 months, they send us to live for 3 weeks in a village. I had no clue what it meant to have a main village and a Harijan colony. And the fact that they had separate water supplies, and you couldn't collect water from the Harijan colony. The Harijan colony people could not collect water from the main village. Now, if our social structures determine a lot of how health is provided and what kind of programs are run where, we have now public health programs where you have women who are ASHA workers, accredited social health activists, who are supposed to be in every village and are intended to promote programs there. What frequently happens is that they won't work across caste divides. So then a lot of people who need access to care are not really getting it. Education is important. Trying to provide more information is important. How do we, is health something that we ask for from our people, from our representatives? Do we influence policy in any way? So if you look at what the Delhi government has been doing recently, so health is a subject that is on the state list. Policy is made at the center, but the delivery of that policy must happen in states. Can you tell me which you think the best states are for provision of health services? So you know, right? Which are the worst states? We all know this. Why do we let this happen? Could we do something to change that? It's well known that if you have educated mothers, you have better health indicators than if you have educated fathers. That actually interestingly flips a bit. In cities, if you have educated mothers, their children are more likely to be obese. So there are You did.
Just correlate with GDP per capita. We have first the rising tide lifts all boats, and that's what's going to solve this.
So a rising tide does lift all boats. As living standards improve, you will get better health. You will see that in children first, because if you start monitoring growth of children, what you will find is that you see less stunting, chronic malnutrition in states that are performing better economically. But if you look at certain states, for Tamil Nadu, for example, the improvement in GDP did not exactly parallel improvements in health. The improvements in health was on a much faster trajectory than just the GDP. So focusing on programs and on having monitoring systems does make a difference. So they focused on maternal and child health and really did a phenomenal job of that. But if you look at what's happening with Swachh Bharat and with other programs, you actually find that some states, Tamil Nadu is not doing very well on that. So basically, what did I want to talk to you about here? Health doesn't happen in isolation. Health is linked to education, health is linked to economics, health is linked to everything that makes us a society. Whether it is culture, we are stratified and in the ways that we access health, the ways we look at prevention, the ways we look at cure, and how we handle what is required for being able to access health for ourselves as people, as families, as communities, comes from our position in society. So if in India we need to think about changes, we need to think about changes in a holistic manner. We have been siloed for far too long. I gave you the examples of all these disease control programs. What do these disease control programs do? Each disease is a target. And once we create a target in India, we will meet it. How will we meet it? I'll give you the example of leprosy. We had the highest rates of leprosy in the world. Very interestingly, we set a target that said we were going to eliminate leprosy, which is less than 1 new case per 1,000 population in an area. We met that target within about 4 years of setting the target. An endemic country suddenly had eliminated leprosy. How did we do it? We did it by saying, well, to diagnose leprosy, you have to see a patch, you have to slit the skin, you have to look for the lepra bacilli. What they did was they stopped doing the testing. Okay? If you came with a florid patch and you had to test it, you would test it, you would give a single tablet and say, okay, now you're cured, I don't need to count you anymore. So what happened after 10 years of this meeting the targets is now our incidence rates of leprosy are going up. We can't hide it anymore. So the siloed approach, this target setting approach is not something that works. What we need to be thinking about doing is putting the person, the family, the community at the center of public health. Instead of making it about my job is to deliver this service, this service, this service, which is what ASHAs are currently doing. We need to look at, are the services being provided, all the services that are required being provided to this person, to this family. If we don't do that, we are going to continue to have the same problems that we have always had, which is that there is a divide between our aspirations and our ability to meet any of these goals. So in the work that we do at THSTI, we spend a lot of time thinking about what is really a fit for purpose public health system. What is it that people want? What is it that people would like to have delivered? And are there ways that we can facilitate that? So I can give you the example of North Korea and you tell me whether you want that model. In North Korea, there is one doctor for every 500 houses. Now, that doctor is required to visit every house at least once a month. Check how people are doing and make sure that they are provided a service. If any of them are ill or require management for chronic illness, it has to be more frequently. And then if they require referral, to send them off to wherever their illness can be managed. Would you like that kind of model where the doctor comes to you instead of where you go to the doctor? I think it's possible in North Korea. I'm not sure that it would be possible here.
How it could be possible for 1.2 billion people in India we have, and it's not, when it's compared with 1 billion people, like how much population that they have.
So if you look at the health and wellness centers that the government is planning to set up now, those are planned as 150,000 such centers across the country. And the idea is that every population of 5,000 will have one of those centers and they will have a doctor there. Currently, we are producing 45,000 doctors a year. But there is a disconnect between the number of doctors that we produce and where the doctors are. If you look at populations in the cities, we meet the WHO standard of 1 doctor per 1,000 population. And there are parts of our country where you don't have 1 doctor for 10,000 population. So there is a mismatch between where services are required and where services are available.
What we can do is like Aadhaar card is there, so we can have a health card. Like we can link that Aadhaar card with health card only. So when we can set up these public hospitals, and then like every week there can be a checkup. Here there is a doctor, so whosoever want to visit, there is a health card. They will be they will come and easily they can go over there.
So I think the idea of provision of better public services is an important one. So the question that is often raised in thinking about public health is it really, in a country of 1.3 billion people, can the government really provide services to everybody? Or are there alternate models that we should be thinking about? What role does the private sector need to play? Right now, the private sector provides services that tend to be higher end services, and you can get the best of medical care in India if you can afford to pay for it. In the government system, there are islands of excellence that do provide that kind of service. If you go to AIIMS, you'll get the best service in the world. It takes its time, but the quality of medical care is good. Can we make sure that there is a gradation of care that is offered to people that are in need? I think what we need to think about is stratification of care and how you make sure that care is appropriately stratified and provided to people. The argument is frequently made that we don't pay sufficient taxes to be able to afford a good health care system. So let me ask you a question. Would you pay higher taxes if it resulted in better health care? Would you pay higher taxes if you had better road infrastructure, better ambulance services, everything related to health? Maybe you need to go to your politicians and talk to them then.
What do you think of telemedicine, smartphones and so on? Is that a potential way to reach more people? Simple.
So he pointed out a
Yeah.
like Kejriwal, he has given cheaper means
He set up the Mohalla clinics.
so he's providing everything in cheaper.
Yes.
So still they are paying the same taxes currently, but still the government is doing the work, right?
Yeah.
So you can't relate that we are paying less tax. That's why if government
So yes, so there are two things here. I think, yes, political will is important. Wanting to deliver services to the people who are your vote bank or people that you are supposed to be serving is very important. But I also think the idea of sensibly taking technology and beginning to apply that to public healthcare systems is very important. We have functioned for too long using tests, using medical care systems that are either 100 years old or have not been appropriately evaluated for our populations. So if you take tests like blood culture, for example, this is a test that was developed, about 100 years ago. Most bacterial culture systems that are in all the microbiology labs that you see were developed about 120 years ago, right? These are no longer fit for purpose. Why are we not using the new tools that are available to us? That is for diagnostics, but for telemedicine, for looking at radiology, it is possible now to be able to get services to a place without necessarily being physically there. Drones are being used to deliver blood as well as vaccines in Africa and in Papua New Guinea. Why aren't we doing that here? In the places that are the remotest parts of this country, I think if we have a sensible approach to healthcare, we can do things differently from how we have done them in the past. India has tremendous potential, and many of you here are the ones who are going to change the world. So I hope that you will try to come up with solutions, and there are some of us here who are slightly longer in the tooth who will be here to help you when you need it. So thank you very much, and if there are any remaining comments or questions, happy to take them.